So, first of all, by a show of hands, how many of you in the audience think that there is a link between vaccines and autism? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Wow. About 23 of you. Wow, interesting. And how many of you don't believe there is a link? Hands up. About 18. So that's amazing. I'm glad that we have this kind of mix in the audience here tonight. This is what Pangburn's all about, getting us all together to have good faith, helpful conversations. So we've been at this for 10 years at Pangburn, producing events. We produced the 4-part Sam Harris-Jordan Peterson series in 2017. If you guys haven't seen our recent God debate between Alex O'Connor and Dinesh D'Souza, that's one of my favorite debates we've ever produced. Check that one out. Also, Dillahunty versus Jordan Peterson's a fantastic discussion. So in our 10 years of operation, I'm not sure that we've ever produced a live discussion with stakes this high. There are people literally dying and living sick due to misinformation. Now, depending on who you ask, that misinformation exists on the other side. We have both sides represented here tonight. On the quote-unquote pro-vaccine side, we have Professor Dave Explains, Dave Farina, and Debunk the Funk, Dr. Dan Wilson. On the quote-unquote anti-vaccine side, we have Steve Kirsch and Dr. Pierre Kory. Like many of the labels that are grafted onto me by others, the debaters may reject these labels, but they do exist in the culture. As moderator tonight, my name is Travis Pangburn, by the way. As moderator tonight, I plan on saying as little as possible and simply allow the dialectic to flow. At Pangburn, we always hope to produce a good faith, helpful, passionate discussion, even when the stakes seem dire. I will ask you, the audience, to please not interrupt these important exchanges. Don here, to my right, will be playing timekeeper to ensure each side has equal amount of time on each topic. 6 topics have been agreed upon for tonight's discussion. The goal is to try to allow enough time for each topic. The side that doesn't get to start the topic will get the final words on that topic. The topics are as follows. Number 1, vaccines and autism. Is there a link? Number 2, new measles outbreak. Is misinformation to blame? Number 3, did the COVID vaccines save lives? And there's also a sub-question to the third question. RFK Jr. pulls $500 million in funding for vaccine development. Is this good for the USA? Number 4, are kids better off being fully vaccinated according to the CDC vaccination schedule or fully unvaccinated? Number 5, should we eliminate liability protection for vaccine manufacturers? And number 6, is Ivermectin effective against COVID-19? The speakers have provided 5 references per topic that everyone can have access to during this debate. You just need to go to pang-burn.com/references. We are going to start with quick introductions and thoughts on tonight's debate before we jump into the first topic. Let's start with Dave and Dan.
You can go first. Okay, so I cannot tell you how disheartening it is to hear so many people still falling for this vaccines autism bullshit. It started with Andrew Wakefield in the 90s in the retracted Lancet study, and it's been a plague on mankind ever since. No matter how many studies are done, no matter how many hundreds of thousands or millions of children that are studied, where absolutely zero correlation is found, anti-vaxxers continue to push this myth, which is absolutely insane and utterly unfounded. Not only is there zero data to support this link and a mountain of data disproving the link. It also just completely betrays any understanding of what autism even is. Autism is an inborn, genetic-based neurological condition. You can't catch autism. You can't get autism. You are born autistic, and then symptoms show up, and people say, oh my God, it's the vaccine, and it's just complete horseshit. There's essentially nothing to discuss here. We're going to discuss it anyway, apparently, but that's how it is.
Yep.
All right, thanks, Dave. Go ahead, Dan.
Yeah, that's what we're doing right now.
Well, I think he just
Yep,
tied that into his...
I'll echo that. And just a general comment about this debate. I think that the evidence is very clear for what the right answers are for each of these topics. And to be on stage with two people who have profited so much and gained so much from saying the complete opposite of what the facts
demonstrate. It's funny when people get money from lying, isn't it?
Is frankly just a little bit frustrating. But we are here to have a debate, and we are going to educate these two people who are anti-vaccine for your all entertainment. And I think you all should enjoy.
Thanks, Dan. All right. Pierre, how about you?
Yeah. I think we already have...
Nice and hot on the mic, Pierre.
I think we already have the answers. So anyway, the opening statement for me is I'll just say that, my background, I have 3 daughters, all of them fully vaccinated according to the CDC schedule. I'm a physician that went pretty high in academic medicine. I was the chief of the critical care service and the director of the main ICU at one of the largest academic medical centers in the country. I also published over 50 papers, maybe 60, and one of my textbooks is translated to 7 languages, and it's in 3rd edition. I was known as a leader in several fields, one of which was critical care ultrasonography. Another one was therapeutic hypothermia after cardiac arrest. In fact, I was one of the leaders who launched the program here called Project Hypothermia. My protocol, my hospital was the first one in all of New York City to cool patients, and by the time I was done, every hospital had a protocol. So I have a long history in medicine. So how did I get to this purported anti-vax position? Well, let's be clear on what an anti-vaxxer is, right? And also let's be clear on what disinformation and misinformation is, because already I'm hearing things so completely inaccurate. Let's be clear. Misinformation is something said out of ignorance or error. Disinformation is something said with the intent to mislead. If anti-vaxxers are disinformationists, what is their incentive to mislead? Why are they so up in arms against people getting vaccinated? It's because they want to protect them. There's only 2 ways you get to be a purported anti-vaxxer. One is through the direct lived reality of your child's life getting destroyed within days to a week of a vaccine. Or 2, you are highly educated and you've done sufficient research into the background and history of the vaccine and vaccine industry. That is very well described that anti-vax positions, patients who choose not to vaccinate their children, are always highly educated. They're critical thinkers who do deep research. And coming from where I told you I came from, I found out that in my research in COVID, in my advocacy in COVID, I came out, I told the world to use corticosteroids in the hospitalized phase of this disease. I did it months before everyone. I got attacked. My whole university went after me. It became standard of care worldwide. When I said the same thing about Ivermectin, my life went completely sideways. Sideways. I've lost 4 jobs. I've been without income at times, but yet apparently I'm a grifter. And how did I get to this position on vaccines? Because I found that I was living in a world where a lie could be told and everyone believed it around the world that ivermectin was ineffective at COVID. And when I saw that happening before my eyes with one of the greatest disinformation campaigns ever perpetrated by pharma, I asked myself, what other lies could they do? And that's how I'm here. Thanks.
All right, Steve, go ahead.
I was hugely pro-vaccine before the COVID shots. And if you asked me, should you get the COVID shot, I was like saying, of course, you'd be insane not to get the COVID shots. So I got my 2, my wife got 4, my kids are all vaccinated. And then I started hearing stories and started hearing stories, and some of them were of friends who had their relatives die. I heard one story from a friend who said that she asked me, are the COVID vaccines safe? And I said, of course they're safe. They're the safest thing ever. I'm like repeating what I've been hearing from the CDC. And I said, why are you asking me such a dumb question? And I was a little bit more polite than that. And she said, well, 3 of my relatives were perfectly healthy, and a week after they got the COVID vaccine, they're dead. And I said, that's impossible. The COVID vaccines are perfectly safe. Nobody, it's like 1 in a million chance. So you can't be 1 in a trillion here. I mean, that's statistically unlikely. And she said, yeah, but they're dead. And so that was the trigger that got me to go and start to look at the data. And there were other stories, by the way, for other people who were getting vaccine injured. I've never heard these stories before for any vaccine. So I started looking at the data. I looked at the VAERS data. I looked at all sorts of papers and so forth. And I ended up writing a 150-page article on questioning whether you should get the COVID shots or not. It was published in Trial Site News, got a lot of readers, super popular. And after I published that article, people on my scientific advisory board, which I had for finding early treatments for COVID, resigned, and they said they never wanted to speak to me again, and I was a bad person. And I said, well, was there something that I said that was wrong in the article? Because if I'm wrong, I just would like to be corrected, because I don't want to be spreading misinformation. And they said, we never want to talk to you again, goodbye. And so people were never willing to tell me why I was wrong. And the best that I can get is people who tried to tell me, oh, you're wrong, but they don't provide any reason that I'm wrong that's backed by evidence. There's just hand-waving attacks. So it's been a frustrating experience for me, people saying that I'm wrong, but nobody willing to actually show the data that actually confirms that I'm wrong and they're right. So I'm hoping to find someone who can do that someday. But in the meantime, I've been calling for data transparency. And there's no study that was ever done, published in a peer-reviewed journal, saying that if you withhold the data from the public, you're going to get better public health outcomes. The public deserves seeing the public health data. It's always being withheld. It's being withheld from everybody in the United States. It's always been kept secret. RFK Jr. is going to change that. But calling for data transparency, why can't we have the data and let everybody decide from the data? Why does it have to be hidden?
All right. All right. Thank you, Steve, so much. We're going to get to the first question right away here. Let's get into it. Dave and Dan, you guys are going to be able to start this one. That means Steve and Pierre are going to get the last word on this question. So the question is, vaccines and autism, is there a link?
So it's funny to me because it's always the same story, right? I was pro-vax and my kids are vaccinated. It's just the COVID vax. But if it was just the COVID vaccine, why are we here talking about the entire vaccine schedule, right? Why are we talking about vaccines and autism? Is there a vaccine in the schedule that you think is good? How is it that we're always fixating on the COVID vaccine and then all of these people here that are supporting you are just magically against all vaccines, right? If you're not anti-vaxxers, how did that happen exactly?
I'll help you out. It's all of them. Keep going.
Huh?
It's all of them. Keep going.
Okay, so he admits it.
Okay.
So you are just against all vaccines.
Yeah.
It's your turn. Go ahead.
So you listed, Pierre, you listed a lot of accolades in your introduction.
Let's, you guys in the audience, please don't heckle the stage. We need to let the information come out. Let these guys have the conversation.
Okay, Pierre, so you listed a lot of accolades in your introduction, and the common line that a lot of people who think that vaccines cause autism say is that autism has greatly increased in the past few decades. You two would agree with that line of reasoning, right?
That's not the primary line of reasoning, but yes.
But it's necessary, right?
That's one of the things, but that's not the primary
But if
thing.
autism was not increasing over the past few decades, that would be interesting to you?
Yes, absolutely.
Okay, so do you have any knowledge, any mechanism, any scientific reasoning as to why there is a biological reason why autism is increasing as opposed to a diagnostic criteria reason?
Yes. We do.
Okay, let's start.
Lay it on us.
So, should we go now?
Yeah, go ahead.
Okay,
It's back and
here.
forth. It's back and forth.
All right, let me be clear. So, vaccines have a number of adjuvants. Many of them have been shown to be neurotoxic and producing neuroinflammation.
Which one?
It's in all of the inserts.
Which one?
Anything with mercury, thimerosal, aluminum, known neurotoxic.
There's
Are
no.
those in
so,
MMR?
So there's no mercury.
Are those in the
Back and
MMR?
forth. Yeah.
So there's
mercury was
no
never
mercury
in the vaccines?
There's no mercury currently in childhood
But
vaccines.
why'd they take it out?
So when they took
2001.
it out, did
Why?
autism
Quite a long time
increase?
ago.
Why'd they take it out?
Because
Because of the public fervor.
Yes.
They had never been demonstrated to be harmful at all. They took it out because of public fervor. But the point is 2001. And when they took it out, did autism rates decline or did they go up?
It's not just not just mercury.
So it's not thimerosal.
So
Check thimerosal
It
off.
say thimerosal.
So did
I said many of the adjuvants.
You said
So which
mercury.
one?
Polysorbate 80
Which one?
aluminum.
Hang on. So you said
Aluminum.
Any of them.
you
They're
said
in the
you
inserts
said
of the
mercury.
vaccines that it cause neurological injuries.
Which one?
He's just
Pierre,
listing one of them.
Pierre, you said mercury.
Yes.
Okay.
And-
First
and
of all,
others.
first of all, that's
You guys
not.
wanna
First
pop
of
on
all,
mercury?
first of all, that's not an adjuvant.
What?
First of all, mercury is not an
It's
adjuvant.
an ingredient then. How's that?
What is it? What does it do?
It's an ingredient in the vaccine.
What
What
does
does
it
it
do?
do?
You tell me.
You don't know, do you?
I don't care.
So we are
I
going
know
to.
It's a
so-
preservative.
So we
I'm
are
not
now
even-
going to have
I
to
don't care.
educate.
It's
We are
toxic.
now going to have to educate them
Yeah.
on what the ingredient
He doesn't
they
even
think
know what
is
it-
dangerous
it
what it does.
provokes an
It's
inflammatory response.
It's also not elemental
It's a
mercury.
preservative. No,
Okay.
it's a
Let's
preservative.
let Steve get in here. Steve, you want to add something?
No, yeah,
Yeah.
it's just that he's just talking about one of the ingredients. It's not just the adjuvants. It's anything
Hang on.
that's in the vaccine that is getting injected.
Yeah, thimerosal's
into
not
you.
an adjuvant again,
so
by the way.
aluminum, for example, can get into you through injection.
Is that in MMR?
Hang on, we'll get to aluminum, but let's stay on mercury. Did autism go up after 2001 when it was taken out of the childhood vaccines? Yes.
It's been
so
increasing for
so would
decades.
you
Yes.
expect autism to go down if an ingredient that causes autism
Yeah.
got out of vaccines?
The thing
'Cause
that
now they're
causes
being exposed
autism isn't
less.
in there anymore. What do you expect is going to happen?
It doesn't quite work that way because
How does it work?
How do you know?
Do you know what else happened after they took
you're asking-
mercury out of the
you're asking
vaccines?
for-
The number of vaccines continued to explode.
Not really.
And
Oh,
what's
really?
no, not by
really.
that
Whoa.
much.
How many?
But also,
Since
what's in
when?
them? We're still looking for the ingredient, right? You don't know what they do,
I
but
don't care about the ingredient. You guys, we're talking about the association between vaccines and autism.
Yes.
You guys are asking for mechanisms. I will tell you the associations between vaccines
Yeah.
and autism. You want to do that?
But you mentioned mercury, and I'm asking for a mechanism
wanna
there, and
talk
you're not
about mercury.
able
I'm
to.
talking
You're not
about
able to do
autism.
that. So we can move on.
No.
There's
I'll
gotta
give
be
you-
a compound that does it, right?
I'll give you a mechanism, aluminum.
So we okay.
Are
Explain
you
how.
familiar, are you familiar with Chris Exley?
Yes.
Okay. So you know he's like the world expert on
He's not.
toxicology.
He's not.
Oh, he's not. Then who is?
There is no single world expert in toxicology.
Okay, well, so
you
he's
like
one-
to you
one
like
of
to
them.
paint this
So he's one of-
caricature.
he's one
You
of
like
the
to paint this
experts in the world.
caricature of
He's been-
science.
He's been doing
there
it
is
for
no one
36
single expert.
years.
So
How? So
been-
who has
he's
been
been-
doing it for longer
he's
than
been-
36 years?
he's been producing slop for 46 years.
Okay. So he's been doing it for 36 years. There's nobody doing more research on that. And he finds kids like a 12-year-old with aluminum
All right. Yeah.
concentration in their brain that is off the charts, never seen before, and the kid is autistic.
Great. So let's start with. I'm assuming you're talking first about the 2017 Exley paper, right?
Yes.
Okay. So did you look at the numbers there in his table of aluminum measurements?
No.
You didn't look at
Hang
them?
on. You didn't look at the
They're
numbers?
off the charts, but you didn't look at the numbers.
There's a
Well-
there's a lot of stuff that I haven't.
Steve, you linked.
It's
the,
your
you
source
sent
that
us
you
the
provided
paper.
for this debate,
Yes,
and you don't know anything about the data in it?
Do you want to? Here, I'll give you some quotes from Chris Exley.
It's okay.
Since you don't
wait,
know
wait,
the paper
wait,
that
wait,
you
wait.
brought, we can
No.
teach you what's in the paper. The numbers are all fucking over the place.
Yeah.
There's no clear trend. And second of all, there's absolutely no way to mechanistically and causally link that to anything. Even if the data was good, how do you rule out the idea that there's a neurological condition that just makes the brain not clear aluminum as well, right? There's no way to mechanistically link that to a causative agent of autism.
So Chris Exley has published over 200 peer-reviewed papers
Data.
on aluminum.
Let's get
in-
to the
in-
data.
He's published over 200 peer-reviewed papers.
Many of which are retracted.
What he says is, I did not see such high aluminum content in the brains of Alzheimer's patient. This was extraordinary. These are some of the highest values ever measured in human brain tissue. Now, go ahead and dispute that. Tell me your source for someone who has higher levels of aluminum than what he's measured.
I'll do you better. So let's go to that table that you didn't read. So let me read off some of the measurements that he got of aluminum in a child's brain. Do you know what a technical replicate of an experiment is?
Sorry, a
technical replicate.
Is this science class that he's asking us questions?
Apparently, it needs to be, because you guys don't even read the studies that you bring.
I'm sorry, Pierre.
Pierre, I think
Let
this,
me.
well, I
Is it
think this-
nitpicky, or are
let
we
me just-
proving
let me
that you
just
have no
make a-
fucking idea what you're talking about?
Nothing to do with what we're talking
Let me just make.
It's
Okay,
the
let's
source
recap.
you brought.
Let's hang on. Let's recap for a bit. Pierre brought up mercury.
No, I talked about autism. You are still sticking.
You need a causative agent, and you don't have
I'm
it.
recapping here.
You said mercury, you said
Yeah.
aluminum.
This is descending into nonsense.
so
It's descending into us showing
we
that
have,
you have no idea what you're talking about.
Here, let's.
you guys,
okay.
let's recap the time here.
Look, but we do need to finish this real quick, because
Yeah.
we didn't bring up the point that that it didn't
I wanna
parse the
make sure
study.
I
There was
have
no
enough time.
data on whether the patients were vaccinated or unvaccinated. The study was shit. You finished that because you read it better than I did.
Sure. So, I mean, first of all, Pierre, I understand you're getting upset, but I think it's reasonable to expect you to know certain things about the topics you claim to know better than the world's leading experts on.
Can I talk
So-
about this? then?
yeah, let's let
Yeah.
Pierre get in. Yeah.
So this request for mechanisms is one of the oldest tricks in the book that's perpetrated by the academics, okay? So this is what they do. When they see associations that they cannot dispel, they do one of a few things. And let's talk about the Institute of Medicine, because you guys actually put that in as a reference. Do you guys know the history of the Institute of Medicine, what it is? So I can ask you these little nitty questions.
Yeah,
So
it's
what
a-
is the Institute of Medicine?
It's an independent body of experts.
Oh, it is?
Yeah.
Okay. How do they get funded?
Not aware.
What?
Not aware.
You're not aware? Okay.
You're not aware,
Fair enough.
but you
All right.
rely on their.
All right, so-
you rely on what
so
they
let me-
say.
let me school you a
You
little
guys
bit.
supplied IOM data. You don't even know how they're funded.
sources
So I care more about the
information that
integrity
you're
of data
relying
than
on
I
is
do
the
about the
Institute of
funding
Medicine.
sources. But we can
The
get to funding
Institute-
sources
the
if you want.
Institute of Medicine is a private organization funded by industry and government.
Ah, okay.
They have produced numbers of reports on various toxins plaguing our society, beginning with Agent Orange. Here we are, 40 years later, numbers of reports of Agent Orange. Each time they say insufficient data. Finally, in 2018, they said, you know what, we need studies on veterans, 30 years later, okay? They were investigated by a congressional committee and found that they manipulated and misled the public. That's just on Agent Orange. They've gone on over the next few decades to address a number of toxins for which the government would be having to pay out massive compensation claims, including Gulf War syndrome, the anthrax vaccine, where veterans chronically ill, lives destroyed from Gulf War syndrome, they tested for squalene, an ingredient in the anthrax vaccine. 95% of those ill had squalene antibiotics. Anyone healthy had none. Okay, so let me finish. I'm finishing my point here. So you have Gulf War, you have anthrax, you have Agent Orange. Nothing to see here. Asbestos in baby powder, baby food, nothing to see here. Autism, we don't know. We don't have the evidence to say yes or no.
Yeah.
There's a pattern. This is an organization that gets hired by industry and government to literally kick the can down the road. And even when they find an association, they do what you guys do.
Yeah.
Elaborate the mechanisms. Show me the mechanisms.
You
It's
know
not my
where this
job to show you the
conspiracy-
mechanism.
I think-
My job is to show you
Yeah.
that they will kill and injure people and make them ill.
Where this conspiracy falls apart is that you're relying on the American government, ignoring the fact that there are hundreds of other countries that also do science. So if you can't provide any studies from other nations that aren't under the tyrannical American government that can produce any kind of data to establish these connections, then what are we even doing here, right?
So-
And I'd like to add on this point about mechanisms. When we ask for mechanisms, we expect an answer. And I don't know is a fine answer, because scientists, we don't expect a mechanism in every single case. There are plenty of things where we know there are known associations, but no known nailed down mechanism. So to be mad that we're asking for a mechanism is a little weird. But if we want to get back to aluminum, which is the topic that you guys wanted to talk about, we can do that.
Well, no. You guys wanted to talk about it because you asked for a mechanism. I want to talk about the Verstraeten study.
You get a vaccine.
I want to talk about the
give a
William
vaccine to
Thompson
your child,
study.
and then the child falls into dense life-altering, nonverbal autism for the rest of their life, either beginning that day or the next day.
That's
There's
not a
your
mechanism.
Which has happened
That's
zero
not a
times.
mechanism.
So can we talk
You're
about
relying
that?
on bullshit anecdotal evidence.
can we
You have
talk-
no studies to support that whatsoever.
Wait, can we talk about the Verstraeten study?
The what?
The Verstraeten study. This is the VSD study. It's done in 1999 by CDC epidemiologist Thomas Verstraeten. You know what he found? 11 risk ratio for thimerosal and autism. So what did they do? They had a secret meeting to go
Simpsonwood?
at Simpsonwood, right, to talk about how do we massage this? How do we tell the public? And there were some quotes. It's a huge transcript, but out of that transcript, there are some choice quotes. Things like, wow, linear relationship, dose-response relationship. You increase the dose, the association increases. People were aware of that, and they talked about, oh shit, we're going to be in huge legal trouble.
Yeah.
How are we going to message this to the public?
It's a cute story, but again, thimerosal was taken out of the MMR vaccine in 2001. Did autism go down?
But wait a second. He found the association.
So
you
did-
guys asked
so-
for
so-
how do you get
no.
how do you get an 11-to-1 risk ratio on something where there's no cause and effect?
So what
And
exactly
why
was?
did they have that off-site meeting to talk about it? Why did they need to do that if it's just a
Again,
coincidence?
very cute stories, but we're looking for data.
Yeah. So
That is data.
So there
A
are-
risk
there-
ratio
No, you're
Steve,
spinning a
Do you know what the-
conspiratorial
do you know what
narrative.
The risk
Steve, slow down.
ratio is,
All right, let
Yes.
Dan
Yes.
respond to the bullshit
Hang
that you
on.
said.
Yes.
You know what the risk ratio is for if you smoke a pack a day and lung cancer? Do you know what the risk ratio of that is? It's a well-known association. Risk ratio is 10-to-1. This was 11-to-1.
So what kind of confounders did they control for in that experiment that you're talking about?
Why are you trying to scrutinize the bullshit?
That's a very important
research
point.
that we try
so
to use.
do you know?
What kind of confounder? What kind of confounder, Dan, causes an 11-to-1 odds ratio?
So if I were to,
what's
so,
the confounder on that one?
Steve, do you know what ascertainment bias is?
Yes, I do.
So if I were to survey a room full of crotchety old men on, let's say, whether or not they have type 2 diabetes, and then survey a room full of soccer players on the same question,
Yeah,
you think that there would be a huge risk ratio difference there?
of course. But what they did is they used
Why?
They used over 100,000 people in the VSD database. They were trying to find out. The whole mission for Verstraeten was to go and get the data to do the study to discredit this whole association. Now, Verstraeten is very skilled in the art of manipulating numbers in order to make the signal go away. And so he went through 5 rounds. It took him 4 years, Dan, to make the signal go away. And he has there's a famous email he sent off saying, I can't make the signal go away.
Yeah,
The subject line
a cute
was,
story.
it won't go away.
It's a cute story, yeah, I know.
Okay.
But-
See how
So-
everything
so-
relies on
If there was
anecdotal evidence for you.
ascertainment
Why
bias,
isn't there a
Dan-
study from some other country that you can point to that's not under the tyrannical American government that
there is.
reproduces
So-
what you're
so
talking
Dave and
about?
Dan-
How about
It turns
you
out-
guys,
What-
2
what
seconds,
about
2
the William
seconds.
Thompson?
Dave and Dan, you guys have your final thoughts on this particular topic, and then
There is
Steve and
one
Pierre,
very important
Steve and
point.
Pierre get the last word on this topic.
Okay, there's one very important point that we didn't bring up, and that's diagnostic criteria. And I would ask you guys, do you have any idea how autism is diagnosed and how that has changed in the past 30 to 40
Yes,
years?
and it's changed quite significantly.
Yeah, how so? Like, how?
Because they want to make the signal go away. So they
No.
broadened it.
How does a professional in the field diagnose autism, and how has that changed? It's not about whatever data you're trying to talk about.
This is not the
today it's-
topic.
Pierre-
When was autism spectrum disorder
Make
added
the
to the
argument.
DSM?
How about you
When
make
was
the argument
autism
that that's
spectrum
the
disorder
cause?
added to the
There are
DSM?
various levels of the DSM. It changed over time.
When was autism spectrum disorder added to the DSM?
What, DSM-1?
Pierre, do you know you were in the
know.
medical field? Do you know? Do you know you were in the medical field?
1994. 1994.
Okay,
So
doesn't
how do
matter.
you imagine that
Change in
impacted?
diagnostic criteria is
Into the
leading
mic
to
there,
rise.
Pierre.
Make
Just
the
to-
argument and then I'll be able to respond.
It's-
Instead, you're asking me little questions. I'm not going to do this. This is just silly.
You're not gonna talk about one of the
Make
most
the
important
argument.
aspects of
You're
this.
not making an argument. You're asking me random.
Okay.
It's not a random question. You're saying
Tell
autism
me why it's
rises
not random.
correlating
Here.
with vaccines,
Tell me why
and
it's
I'm
not
telling
random.
you that it's just diagnoses.
I'm not
gonna-
Because prior to these diagnostic criteria, level 1 and 2 autistic children were not getting diagnosed, and now they are. Do you know how I know this? Because I have an autistic son. Okay, so I know about how this is diagnosed. Okay?
And I'll complete these thoughts. Pierre wants us to just tell him the facts instead of quiz him
He
on
just
what he
wants
should
to
know.
steamroll
so
everything.
let me explain. So we know that autism is genetic. 70 to 80% of autism cases are genetic. That has been-
data versus bullshit.
So there are several genome-wide association studies showing that autism is genetic. There are several twin and familial studies showing that genetics is an extremely
That's fine. They don't-
strong component. Also, there
Yeah,
is
you guys are
data
gonna get the
looking
last
at rates. There is data looking at rates of non-profound autism versus profound autism in the past 16 years. It has been shown convincingly that the lion's share of the increase in autism that RFK says is an epidemic is due to non-profound autism cases that are being caught by the expanded diagnostic criteria.
Which were not diagnosed in the past.
Doctors are not looking at kids for 10 seconds and looking for an autism diagnosis because they're flapping their hands or being nonverbal. It's expanded. It's much more broad than that. People can be functional and autistic. That was not recognized 20 years ago.
Okay, final thoughts on the topic by Pierre and Steve.
All right, let me say three things about this. Kennedy, RFK Jr. Talks very often about this. You know, when he was growing up, never saw an autistic kid. Today, he still can't find an autistic person of his age. So it's not the diagnostic criteria that has changed. So that's
He
that's
definitely
the first
knows
thing.
autistic people his age.
The second
Totally
thing
wrong.
is there has never been a before and after study looking at the timing for rapid onset autism. About 25% of the cases of autism, plus or minus, happen very rapidly within a week. Did you know that every single case that we can find, at least 80% of those cases happen within a week after a vaccine, 20% happen a week before the vaccine. So if it's not related to the vaccine, then why are 80% of those cases happening after a vaccine rather than right the week before? Nobody's been able to explain that. Nobody in the world has ever done that study, and they never will because they don't want to know the truth. And that's the most important thing
So cute.
that you should know about this. And the third thing is that when William Thompson, who led the CDC study on autism and linking it with vaccines, and they found a link, you know what happened? His bosses told him, destroy that data. So it will never see the light of day, and let's publish the paper as if we had never seen that link.
Stories and lies, data.
This is how corrupt the CDC has been. Thompson was called to testify in front of Congress. He was subpoenaed to answer questions. He was deposed under oath. You know what happened to that deposition? It's sealed, so nobody will ever be able to see it.
CDC doesn't run Sweden.
Transparency. That is hiding the data from the American public.
Okay, thanks, Steve. Pierre, do you have anything to add?
Yeah, I mean, I'm sensing a really difference in perspective on the world, and I'll just explain mine, and it'll explain how the rest of this evening is going to go. What happened to me and what transformed me was discovery of the massive influence of money in the pharmaceutical industry in almost every institution and aspect of science. A scope and a scale I never knew, and I was a practicing physician for 20 years before I left, in disgust. By the way, you know who else left in disgust in the way I did? Editors of the highest impact medical journals in the world over the last 20 years have all left. One of them, Marsha Angel, wrote a book about how the pharmaceutical industry has literally taken over all of medicine. And I'll give you the 2-minute primer. It starts at the top, $1 trillion industry named pharma. The captains below, by the way, that's a criminal syndicate. They are now up to $65 billion in the last 20 years, no, $126 billion in the last 20 years in criminal and civil penalties, which is more than double the rest of the industries combined. Under them sit the medical journals, high profit margins. Most of it comes from pharma, almost all of it comes from pharma. You have agencies which are fully captured in ways like CDC Foundation, FDA is the revolving door, and NIH is through royalties. Then you have the professional societies, don't even get me started on those. Those are bought and paid for. Then you have the researchers whose careers never go anywhere if they publish inconvenient science. Then you have Congress. In 2021, $666,000 per member of Congress, okay? Then you have the Little Institute of Medicine, who's the little prostitute hitman for all of science. These guys are gonna be yelling about these studies with hundreds of thousands of people in it and how it definitively shows no proof, and there's no evidence that there's autism. And where are the studies showing people falling in left MMR? They have no idea of the immensely rigid and tight control of what appears in journals. They do not know. They are being fed propaganda, facts.
Every single paper is wrong
and
because
then they go out to their
pharma.
little podcasters and see how wrong these guys are? They don't know how to think.
Does the
This
CDC
paper
control
says
Sweden?
so. The New England Journal of Medicine says so.
Chill.
And so this is why it's very difficult to debate, because the science that I'm bringing forth is that is censored, and what they're bringing forth is that is which is propagandized. And so if they don't recognize the validity of many data sources, and especially they seem particularly unconcerned when we're revealing scientists who are literally suppressing and having to whistleblow data they've been taught to manipulate and hide, like Thompson. The CDC was sitting on data showing massive rates of autism in Black and African American children. And you know
Okay.
what? You know who his boss was at the time? CDC director. She left to head Merck's vaccine division after she left and got him to do it. So I don't know what world they live in, not the world I do.
All right, thanks, Pierre.
I live in the world where the CDC does not control European
Well,
nations.
one sec, Dave. We do got to move on to the next. What's going on here? Oh, okay. Yeah, and just to recap, Steve had the most time on that one, 11 minutes and 14 seconds. Pierre second with 10 minutes and 3 seconds. I'm just doing this for the record of the video. Dan had 7 minutes and 1 second, and Professor Dave had 6 minutes and 14 seconds. So we got to move on to the next topic. Steve and Pierre get to start. Let's try to let each other finish their what they want to say a little better than the last round, and then we'll get responses. So the next question is. New measles outbreak. Is misinformation to blame? First to go is going to be Pierre and Steve.
So I assume what's implicit in that question is that people are misinformed, not getting vaccinated, and that's what's caused the epidemic? Is that the better phrasing of the question? Is that what you guys agree with? Misinformation is to blame for the rise in measles?
Plays a role.
Okay. So, first of all, there's been measles outbreaks all the time, every year. This was definitely the biggest one in 25 years. It's not unique to the U.S. In fact, measles has been exploding around the world. 27,000 cases in the U.K., over 100,000 across Europe. They're popping up everywhere, sometimes 30x to what they were before the pandemic. Why has this been increasing over these last few years? That's a question I want to put in your head. Interestingly, and I was shocked to learn this, you know what? The U.S. has done pretty well. In Texas, there was like 1,000 cases. There's 12 counties in Texas with not one case, and yet the Texas Health and Human Services kept saying that this is the most contagious thing ever, and that, scaring everyone. They even talked about lockdowns. They want to vaccinate everybody. It actually wasn't that bad, and no one died. But yet, going back to my point of how pharma controls this whole thing, what pharma is really good at. Oh, by the way, in those things that work for pharma, don't forget the media. The media will amplify messages to you, to scare you, to get you to do things. They will blame those who have vaccine hesitancy. This is why in my life I've been attacked, because I'm coming out with inconvenient scientific opinions to the pharmaceutical industry. So was misinformation to blame? I don't know. Ask Europe, ask UK, ask all of those other countries, some of the most highly COVID vaccinated countries in the world. And there's been an article in Bloomberg, which I actually wrote a rebuttal to, where they literally discussed in the article, they can't figure out how the best COVID performing countries are getting hit the hardest with measles. Maybe they have a mechanism for that. Why would suddenly all these that had super high COVID vaccination rates are now seeing measles like they've never seen in history?
All right, Dave and Dan.
All right. I'll go first. So just real quick, I know we moved on from this topic, but I would want to just point out, when it comes to autism in relation to MMR vaccines, these two would like to tell stories about suppression of American institutions and capture, but there have been studies all around the world confirming that MMR does not cause autism, including one study from Denmark using 657,461 children studied over the course of a period of 11 years, showing no link between MMR and autism. Now, moving on to measles and the current outbreaks and misinformation, we know that where measles is the worst, vaccines are not. So in areas of the world that have the lowest vaccine coverage, that's where you see the most measles deaths, the most measles cases, and the most measles hospitalizations. That's true in the current outbreak in Gaines County, Texas, where I believe the vaccination rate for measles was about 82%, and the epicenter of the outbreak was a pocket of mostly unvaccinated communities, mostly Mennonites. So we know that we don't have to make up stories about, oh, they're suppressing data and this group is shady and they want money, which, by the way, only one group on this stage sells supplements, and it's not Dave and I.
Who sells supplements?
Or expensive telehealth.
You guys don't.
You accuse me of selling a supplement?
You guys don't
Get
sell
your facts
supplements.
straight, dude.
You guys don't sell supplements anymore.
Don't ask me. You seem to know, huh?
You guys don't sell supplements
You just accuse
anymore?
me of selling supplements?
Do you not advertise supplements?
Have I ever sold a supplement? Do your research, dude. Get your shit straight. What the hell is this?
Yes,
You want to
Steve.
start accusing me of stuff that you have no idea? Bring something real if you're going to accuse me.
So
I don't
you-
want to hear this nonsense.
So do you not?
Check yourself.
Have you not?
What do you charge
advertised
for a
and tried to sell,
consultation, Pierre?
Spikevax supplements.
You're going to tell me I've sold a supplement?
I'm asking
I
you.
think you got the wrong
Steve
guy.
sold
You're getting crap
supplements.
straight.
You
Can you
charge
say yes or no?
$1,600 for a consultation.
What's that?
Sorry.
You charge
I
expensive.
work for a living. I spend a lot of time with patients. How is that selling a supplement?
Telehealth.
I didn't
I'm
say
a
supplement.
physician.
This guy.
Telehealth physician.
Sorry, what supplement am I selling?
Is that?
Sorry, what?
What supplement am I selling? I'm not aware that I'm selling.
Dude,
a
the Wayback
supplement.
Machine exists, man.
The nattokinase supplement. Does the audience know about this nattokinase supplement?
Hey, guys, he's confusing us with McCullough.
You guys don't endorse the wellness company in any of your content?
Yeah. Love the wellness company.
You don't think that supplement is good?
It's nonsense. Keep going.
Sorry,
Okay, good. We agree on something. We agree that the nattokinase supplement
We
is
agree that
is-
you're
is
wrong
garbage.
in making a false accusation. Thank you.
If
That's
I made
what I agree on.
if I made a false accusation about you selling supplements, then I would take that back.
Appreciate
but
it.
we agree that the Spikevax supplement with nattokinase is garbage. We agree on something. Great.
Yeah.
No?
How's your eye, by the way? Getting better?
No,
No.
no, I'm permanently blind.
So
Thanks for asking.
it's a terrible supplement, right? Untested.
I do not sell supplements. You
Okay.
said I sold supplements. I do not sell supplements.
Okay, so untested supplements very bad. At least we'll come away
can
with
agree
that.
on that.
Untested, unregulated supplements are bad. We'll just come away from this with that.
Yeah. So
Yeah.
So you like to tell
It's completely off topic.
you like to tell stories about, well, it's not off topic because you're talking about corruption and
because
and,
we're
and-
talking about the measles outbreak, and suddenly you guys
brought up-
shifted it to
and-
whether I sell supplements or not.
and
I
you
mean,
guys
I don't get
but
how-
you guys
how we're
brought
there.
up conflicts of interest and profiting off of stuff.
Yeah,
and
yeah, I don't-
you got to admit that people who sell misinformation also profit greatly from it.
Actually, I'm not. I'm making a fraction of what I was making before as a high-tech executive.
As do I. I've lost an incredible amount, my whole career, my reputation, and a lot of money. So you guys want to call me a grifter? Get your facts straight.
That's bullshit.
Just because you see me on social media or something, you think that makes me rich? I do not profit over my personal profile. I'm a physician.
Maybe we can compare net worth later.
I opened a practice dedicated to the treatment of the COVID vaccine injured.
Okay,
And
we
I'm
can look up
immensely
net
busy
worth.
with
yeah,
that.
hawking
So-
ivermectin. Yeah,
Let's
that's-
try to get
that's-
back. Let's
so
try
back
to
to
get
the-
back
Pretty
to
good shit.
measles, guys.
Back to measles. We can talk about stories of people suppressing data and all these boogeyman stories, but if you look around the world, in reality, measles deaths, hospitalizations, and cases are worst where the vaccine is not.
3 deaths in Texas, by the way. He lied.
Yeah. Do you guys?
By the way,
are you
You
guys
said
saying,
no one died in
by the way,
Texas.
Are you guys saying nobody died of
two
measles?
of them, I was personally tasked with doing the expert medical review. They did not die of measles. That's one.
Bullshit.
The third.
Okay, wait, what did they die of, and how do you know?
So you want to call bullshit
I'm
when
sorry.
I spent literally
I'm sorry,
15
wait.
hours reviewing
Are you-
records?
Are you
This
saying?
is not- this
Are you
is not
saying you
credible.
determined the cause of death?
What's that?
Are you saying you determined the cause of death?
Absolutely. Medical records.
Have you ever done a medical record review? Like with
I'm
autism?
sorry.
You looked at
I'm
the
sorry.
medical
I'm sorry.
records?
You reviewed their medical records, or you actually determined their cause of death and reported
I
it to the
came to a
county.
conclusion as to cause of death, which was the
So
task
you did
that I was
not.
put
So
forward.
you were not.
This is the conversation we're going to have?
Yes. So you're not. So you're not report. You did not report the death to the county and say this was the cause of death. You looked at the medical records and had a different opinion.
I have a different opinion, yes. And I can tell you...
I wonder why that would be
with
motivated to
decades
go
of
in a certain
experience
direction,
doing
huh?
malpractice case reviews. I'm a pulmonologist and intensivist. I looked through immense amounts of records, collected a lot of detail, and I'll even tell you that one of them, about 60% through, I was actually thinking that measles might be the proximate cause. And then everything changed. Neither of those were from measles at all.
So how do you-
The third one is a man for whom no records are available. There's very little information. There's a claim that he died. But I will tell you that the media went nuts with 2 children dead. And the families went to children's health events, and then they tasked me with doing the review. And I found that both of those cases are slam dunk lawsuits.
Did you review
Lawsuits.
you review the 83 in Samoa from RFK?
What does that have to do with anything? We're talking about measles here.
We're talking-
No, we're talking about measles around the world. It's
No,
not
you-
just
you
America.
are. You
So
are,
hang
so
on.
keep
I'm
talking.
talking about measles in
Pierre,
general.
Pierre, let me
let's
explain.
talk
Other
about
countries don't matter?
Hang on.
Let's talk about what we reviewed.
Let me
He
explain.
reviewed the medical records. Did you guys review the medical records in Texas?
So, Pierre, how do you determine if a measles death is a measles death?
So you would look for evidence. So if you're going to die of measles in the way these 2 children died, which was hypoxic respiratory failure, you would have to have evidence of measles in the lungs, okay, through testing. On one autopsy...
Did they test?
No, these were both severe, overwhelming bacterial pneumonias. They were both tested, yes.
So do you think that secondary bacterial infections are not a,
They're as common as the
potential
day is
cause
long.
of
My
measles
daughters
deaths?
had one after the flu. They're as common as day is long.
Yeah.
These were gross mismanagements. That's what I'm telling you.
Yeah, they
These
were
are
given the
both
wrong-
slam dunk
They were given the wrong
medical
drugs for the
malpractice.
So-
They missed so many things.
so
It's one of the worst.
so all the other doctors are just wrong who looked
What's
at the
that?
case?
What doctors?
The
What
doctors who
came out with
determined
their
the cause of
opinion?
death.
Yeah, who are those?
The doctors who saw the actual
How do you know it
girl
was a
and
doctor?
treated them.
Yeah, I know what they thought. I saw their records every day. They kept saying measles and pneumonia while she's dying from an overwhelming suppurative bacterial infection. That's why she died, is because they stopped antibiotics and steroids, and they watched a child descend into the zero oxygenation state. I got to tell you, that case gives me nightmares. And you guys want to sit there with a fucking smirk, like you think you know everything? You want to bring up Samoa? And I got to watch these children
we're
die
talking about
while
fucking
the
measles.
media goes, while the media and you guys go nuts that some measles.
We're here on an
Pierre.
anti-RFK tour, and you think I'm not going to bring up the time when he went to Samoa, caused extreme vaccine hesitancy, and then 83 kids died of measles? You think I'm not going to bring that up?
Do with the measles epidemic that we're supposed
So
to
the-
talk about?
so the-
Because 83 kids died of
The
measles.
measles epidemic from misinformation.
The
I'm
topic-
not talking about
yes,
1983.
and
They
Samoa.
died.
Samoa-
83 kids died because RFK lied about vaccines. you
Samoa-
think I'm not going to fucking talk about that?
Samoa is a
Jesus
previous case
Christ,
of
dude.
misinformation leading to a measles outbreak, just like similar to what we're
It's
seeing
the
in Gaines
exact
County, Texas.
topic we're talking about.
And so, Pierre,
No.
you're saying that all the other doctors are wrong and you're right. I'm sorry, but if practicing doctors who are actually treating the child have a different
is not
opinion than
you.
you,
Only one
I have
doctor.
a hard time just taking your word
Only
for it.
one doctor, which is the attending physician. She was proven wrong.
Based on
after
what?
that. No, when the
But
tests come
proven
back
wrong from
showing-
you?
From a bacterial culture of the lungs showing a wickedly multi-drug resistant bacteria that she never treated or looked for.
So it was multi-drug resistant.
yes.
So antibiotics probably would not be effective in that case.
There would have been a few she could have tried. And in that case, there were algorithms that would have led you to the correct antibiotics. She employed none.
There are cases
You
where
guys want to battle me on a case you know nothing
there
about?
are cases where secondary pneumonia infections are too far gone with multi-drug resistance, where it's really hard to do anything. But it would not have happened if the child was protected against measles in the first place.
All right. So I'm actually gonna stand down on this, and I'm gonna defer to my the pulmonology expert here, who clearly reviewed the case and comes up with different opinions. So I defer.
We're going to go with the opinion of
I got it wrong.
licensed doctors, I think, probably probably a better way to go.
Yeah.
Yeah.
Yeah, I'll go with doctors who didn't lose their job. So
Yeah.
you know, But
having RFK travel to Samoa does not. How is that? Was Samoa having a measles problem before RFK came?
so the measles vaccination rates in Samoa were dropping because of misinformation that is the same misinformation that RFK Jr. pushed on his website. Because the whole impetus for the vaccination rates dropping was, I don't know if it was a mistake or malicious, but a nurse resuspended an MMR vaccine and muscle relaxant, and that killed the child. RFK took it upon himself to take advantage of that tragic death and spread misinformation about it and scared other people into not vaccinating.
So wasn't there a measles vaccination program in an adjacent island that happened around the same time?
Yeah, and that island was protected.
Oh, really? Or maybe that coincidence of vaccinating that other island caused the measles outbreak.
Are you saying that measles vaccines can spread measles?
A measles vaccine is actually live measles virus, you guys.
It's an interesting coincidence, isn't it?
Not really. Because the island, what's a bigger coincidence is the vaccination rates on the island that had 83 kids fucking die dropped precipitously below the level of herd immunity.
Before RFK came.
While he was spreading misinformation about the impetus for the whole drop. And then he
was there for something else. He was on a beach vacation. It had nothing to do with RFK.
He went there and met with local anti-vaccine activists to promote their cause.
And suddenly, just like that, just like a light switch, measles comes out of nowhere.
Not nowhere.
Not a light switch.
How's it come out of... They're
when
on
kids
an
stop
island,
vaccinating.
They're isolated. Where's the measles coming from?
So you think Samoa is isolated? Wait, do you think airplanes don't get to Samoa?
Where's it coming from?
From people who are carrying from unvaccinated
people who are carrying the virus. It's not an isolated tribe. It's a civilized place.
Unvaccinated people who carry the virus. Do you know how reservoirs work? Viral reservoirs?
Yeah.
Okay, so you know that measles circulates in the population among unvaccinated people?
Yeah, like what do you mean? Like out of thin air? Like measles exists. You understand that, right? So when people don't vaccinate and it appears, like you're claiming this is some kind of magic or something?
So why aren't all of these unvaccinated people in the United States, they're not all getting measles? Why?
A lot of them
you don't automatically get measles. You have to come into contact with it.
Why are we just seeing this now?
Well, there's herd immunity with measles. You know that, right?
Because vaccination rates are getting low enough that herd immunity is eroding.
Because of RFK?
In part,
he's
yes.
the number one
he's been working
spreader
for decades
of this propaganda.
To spread misinformation about measles
vaccines. It's not
vaccines.
just him, but he's the number one guy. I mean, you guys help a lot too. Like you're probably in the top 5. Like,
thank you.
Yeah,
you can get to number one day, though. I mean, I have faith in you. You'll get there.
So can you tell me how all-cause mortality has dropped after they introduced the measles vaccine? Can you cite a study that looked at all-cause mortality of kids, showing that it dropped after they introduced the measles vaccine? Because I couldn't find one.
I sent you one. That was on the list of studies.
Didn't read it, did you?
I have.
Yeah. So let me describe it to you.
Should have.
So it was actually this is actually a really interesting story. So measles vaccines were not rolled out at the same time in each country all around the world. They were rolled out in separate years, sometimes in separate decades. And 3 countries in the study, I think it's Denmark, Sweden, and the U.S., they looked at the time of rollout for the measles vaccine, and they saw a precipitous drop in all-cause mortality that was actually greater than what they would expect with just measles mortality going away. So scientists thought, oh, that's really interesting. Let's confirm that. The paper I sent you confirms that. It's a precipitous drop in all-cause mortality every single time, sometimes in a different decade, right after the measles vaccine was rolled out. And it was found that measles actually can infect your memory B and T cells. Do you know what the significance of that is?
Yeah.
No. Yeah?
Why don't you just keep talking?
Memory B and T.
Answer your questions.
If you know, you can just say yes and we can move on.
Just talk.
I will continue to educate you. Sure. Memory B and T cells are cellular immunity. Your immune system depends on these cells in order to create antibodies and exert cellular immunity against pathogens. So measles can infect these cells, and when the measles infects those cells, they die. They're either cleared by the immune system or they die off from the measles infection. So that means that these kids who are getting measles, their immune systems their memory is essentially getting wiped in a sense. And it's a phenomenon called immune amnesia. that is well characterized now. It's characterized mechanistically by what I just said. And that is an explanation as to why the all-cause mortality dropped further than what we would expect for just measles mortality in these countries that implemented the measles vaccine.
Let's let Pierre and Steve finish anything else they want to say for this topic, and then Dave and Dan, you get the last word on this topic.
So, if there was a slight change in the slope of decrease to something called precipitous, that would have been from like 1.5 to 0 per 100. And I'm making up those numbers, but I know the curves of mortality of measles had been plummeting for decades, largely due to other reasons. When many vaccines were introduced, the mortality rates were near 0 from very high and early in the century. So to see this myth that there's this magical impact on public health of vaccines in terms of mortality, it's just not there. I could see maybe cases in some certain diseases that there's some effect. But when you make a decision to give someone a vaccine, you have to ask yourself a few questions. First of all, what is the risk of getting that vaccine? What is the risk of getting that disease? Almost all of the things that we vaccinate for now have near 100% survival. And then you have to ask yourself, how commonly is someone exposed to that vaccine? And when you were talking about healthy children. This blanket program that these guys are propagandists for, the jab every arm for every disease in every child, and if anyone who says no because there's a specific circumstance in my child, they're an anti-vaxxer. It's ludicrous. It's not how you practice medicine. Medicine is nuanced and individualized. Every patient is different. Every product is different. They don't even know that even the different manufacturers have different products, different risk profiles. And then the bigger point that I want to make, and I'm just going to come back to this again and again, because they keep saying they're going to teach me something. I am seeing the biggest blind spot in two people I've shared a room with in 5 years, which is this complete, either willful or accidental, or actually purposeful ignorance of the system in which it operates. Science has developed sophisticated methods to suppress the risks of vaccines, and it's been going on for decades. So anyone who claims safety, that is a curated and propagandized objective. It's called disinformation. And by the way, all of you guys have been victims of disinformation. You know who invented disinformation? The tobacco industry. They developed 5 tactics to get you to believe that cigarettes didn't cause harm. Those tactics are still in play, and they are still sending out propaganda. You know what propaganda is? It's a message or a story to get you to think or act in a certain way. And I walk through society today, I see victims of propaganda around me. They parrot narratives and consensuses, the scientific consensus. They're all manufactured. And to hear these people, you know, this guy, he just quoted a Danish study for autism. Let me ask you a question. This sounds really good what he said, right? 500,000 kids. They looked at kids who had the MMR and who didn't. And they looked at rates of autism. And they concluded that it was actually lower if you got MMR. Problem with that. In the raw data to the study, it showed a 45% increase in autism. But the conclusion of the study was there was a suggestion of a decrease. What happened between the raw data and the conclusion? Well, they controlled and adapted and modeled. How did they do that? Unknown. For a paper of such importance, which every international healthcare organization around the world used to uphold and shove down your face that there's no link between autism, they did not say how they reversed the study's conclusion. If you were going to peer review and publish that study, any peer reviewer would say, how did you get from here to there? Not in the study, not in an appendix. So that's just one little example of what these guys don't know. This guy's literally when I saw that paper in the thing, I laughed. I laughed out loud. I was like, okay, yeah, of course they're going to put that paper in, because that's what supports their thing. This guy's saying hundreds of papers and hundreds of thousands. There's 2 other papers they use for autism. DiStefano, you know what he did? He looked at number of antigens and tried to correlate with autism. Do you want to know why he didn't look at number of vaccines and what the difference is? During the period of his study, the DTP vaccine went from 3,000 antigens to 4 to 6. And that's when he was doing this study. It's a very bizarre choice. Do you think that's a little weird that someone would choose antigens? Then the third one which is banana. That's another one the entire world holds up, like you guys. That one, remember, that's the one in Canada, where they saw autism rates rise while MMR vaccinations fell. And they said, see, it disproves the link. Fun fact, the autism rates were increasing in Montreal, and they used data from Quebec City. Could you possibly tell me why they wouldn't use autism rates in Montreal and vaccination rates in Montreal? Why would they use a different city? Just a question. I mean, is that like a kind of a study design that you guys would come up with?
All right, thank you, Pierre. Steve, yeah, go ahead. Steve, did you have something quick to add on the measles topic?
I'll just say something quick.
Yeah.
Whenever they report these measles cases in the press, they have two buckets: vaccinated or unvaccinated and unknown. Why do they always lump the unknown with the unvaccinated? The reason is it serves to scare the public, because it looks like they just hear it as, oh, it's the unvaccinated that aren't getting hit. Well, actually, why would they need to lump it in with the unknowns? What they should be reporting is, here are the number of vaccinated kids who got cases, here are the number of unvaccinated kids who got cases, and here are the unknown cases. And they never do that ever in the press. I wonder if there's a reason for that. Do you think? Maybe?
All right. Thank you, Steve. Dave and Dan, you guys got the last word on the measles topic.
Okay. Real quick before I get started. I just heard Pierre say that it's hand-wavy or like secretive to control for factors or confounders in the data and not tell you what you did. The methods of every paper tell you what they controlled for and what statistical tests they do. They do.
Not that one, sir. Show me the paper where the methods are.
Yeah, we can do that.
Oh, you can?
Yeah.
You guys mind if we take a 5-minute break? You can go on the internet and find it for me? You can show me the methods? Let's do it.
In this paper right here.
It's Madsden 2004.
Sorry?
Madsden, I think it's 2004. M-A-D-S-E-N.
I'm talking about
Danish paper, 500,000 kids. Yeah, that was the author chief.
We're talking about the Danish one.
The Danish study, right?
Yeah. So real quick. So do you think it's
the study, sir?
So do you think it's not important to control for confounders in a population?
Of course it is. I'd love to see how that was done, though, because it's a pattern. Yeah. Do they clearly? I've never read a paper
Dave
before. The statistical models that they use, did they explain them or provide them? No.
Yep. All right, so we're not going to argue in the audience.
Yeah. Let's try to keep going here.
So it is important to control for confounders. So why do you weigh the raw data more highly than the controlled analysis?
Here's the thing: a pattern of suppression and manipulation of trials around autism has
all
a
over the
scope
world?
and a scale you don't even have any idea how to
all
comprehend.
over the world?
That's just. How about the three that I just gave you that are used all around the world? Madsden goes from 45% increase to 8% lower. You got a guy who chooses to study antigens when a vaccine goes from 3,000 antigens to 4, and he says there's no correlation with autism. And then you have a guy who uses data from another city. There's no reasons for any of those three things. My problem with Madsden is that the statistical modeling comparisons that she carried out in a paper of that import that's held around the world, you would think she would be transparent. By the way, science should be transparent. And when it's not, you should be asking questions, not just shoving it down your throat and screaming it into social media.
Dave and Dan, final words on the measles topic.
Yeah, I mean, the methods are transparent. You can go and look at what was controlled for. And these are studies from all over the world. I was a scientist working in academia at one point, and scientists, by and large, want to basically compete with each other to be the best nerd on the block. They want to prove the other colleagues wrong so that they can show that their results are the most important. That's what scientists ultimately want to do. They want the truth, and they want to be rigorous and objective with their data. And if their colleague is wrong, they will call it out. That is what the scientific community is. It is not this weird, shadowy organization where the CDC says something and we all say, yes, yes, of course.
Dave,
no.
have you ever researched anything that was inconvenient to pharmaceutical industry interests?
Let's
No.
let Dave and Dan
I'll
finish.
tell you what, I hadn't either my entire career. None of my research ever threatened pharma until my research on ivermectin, and my life blew up.
Sure, but
So-
then, I mean,
so you don't understand science.
I do, and we can get to the ivermectin topic later, but
We will.
we'll get there. But the point is, the scientific community is very competitive and objective in their approach. They will do the best
Not
they
when
can
they work
to
for
study.
pharma.
Let's let them have the last
So
word there, Pierre.
pharma is also checked by the rest of the scientific community. The scientific community is able to do their own research and say whether or not pharma is correct or not. That's why pharma is not allowed to just put anything on the market. It's a very rigorous and extensive process. And even after they get to the market, data published by independent researchers can get a drug pulled off the market.
Thanks, Dan.
Look,
Dave,
this-
go ahead. Yeah.
This narrative here that they're spinning, he relies on this emotional hook of pharma controls every paper in every journal and every scientist at every university and
Never said
any
that.
institution and
That's
any
what
company.
you're saying about every paper.
Never
Because
said that.
this is the only way to sell this story, right? There's no way that the entire scientific community, the global scientific community working in all of these sectors, can cover something up. It's not going to happen. But that's why it is narrative driven. That's why it has to go this way. And we're going to talk. And MMR has a decades-long track record of being proven to be incredibly effective, incredibly safe, and people stop taking it because of lies. They stop taking it because of lies, and then kids get get measles and die. 83 dead in Samoa, RFK's fault, blood on his hands, no remorse. And it's gonna start happening in Florida immediately.
All right.
And it's the fault of people like this.
We are.
That's what
we
it
are-
is.
We are going to move on to the next topic. We got to get rolling here on these topics. Just to recap, that was leading 12 minutes and 30 seconds for Pierre, 10 minutes and 4 seconds for Debunk the Funk, 3 minutes and 31 seconds for Professor Dave, and 2 minutes and 58 seconds for Steve. Topic 3, and Dave and Dan, you're going to be starting this one. Did the COVID vaccine save lives? And also a sub-question to this topic, RFK Jr. pulls $500 million in funding for vaccine development. Is this good for the USA? Go ahead.
So I'll just start off my introduction to this topic with the sub-question to that topic, which is RFK's pulling of $500 million worth of mRNA vaccine funding from the U.S. I want to point out that among those projects that have lost funding are projects for an mRNA vaccine for HIV. And I just want to point out that RFK probably does not care about a potentially promising vaccine coming out for HIV because he doesn't think that HIV causes AIDS. And I think that is very, very troubling to support
Head of the
in an individual.
HHS, everyone.
Yeah. He has written chapters in his book about how HIV does not cause AIDS, was not responsible for the AIDS epidemic, and so he just is going to hamstring efforts to help people who are the most disadvantaged when it comes to facing HIV/AIDS, which are people in the world who are still suffering most from it. So I think that is incredibly disgusting and monstrous of him to do, and it shows a complete lack of understanding of not only scientific data, but an understanding of who is suffering in the world and who needs the help most.
Thanks, Dan. Dave, did you have some opening thoughts there on this topic?
Well, we're going to get into the data of the COVID vaccines as well, but they will try to use things like VAERS database and inflations of unreliable data on VAERS database, personal surveys, all of their sources for trying to pretend that the COVID vaccines killed all these insane amounts of people. 100% fabricated. Plenty of studies showing that they objectively saved millions of lives. Once the vaccines had been rolled out, it's extremely clear that the deaths were after that point 90% were unvaccinated. So there's just as with all of these topics, there's going to be a reliance on disinformation, lies, distortion of data, unreliable data to try to pretend that COVID vaccines, like all of the other vaccines that they're railing against, have done things that they simply have not done.
All right, Steve and Pierre.
So I'll agree with a couple of things you said. So I agree that there are many papers that say that. Granted. Going back to your comment about how it can't all be a conspiracy. Now, let's be clear. I didn't say that all of science. I will say there's areas of science that when they present a threatening to the economic model.
You alluded that all of the journals are compromised.
Let me finish my sentence, okay? You said a conspiracy. Here's where you do not know what you're talking about. It doesn't require a conspiracy. It's nothing but incentives.
No.
Stay in line, and that's how it happens. It goes to the societies, the researchers, the journals. All they have to do is behave according to incentives, and
not
it all
one
falls into
whistleblower,
place,
right?
okay?
Nowhere in the world, not
Now,
one whistleblower.
In terms
this cabal.
of this idea that they saved millions of lives, you'd have to really ponder for a second why life expectancy in the U.S. dropped by 3 whole years, starting in late 2020 to 2024. 3 years. And if you guys can do math, I know you're like master scientists and biologists, but if you remember math, for life expectancy to drop, who has to die? The youngest and healthiest, the least risked towards COVID. And what were they dying of? Nobody knows. Suddenly, young people were dying like mad. And you know where the data comes from? Doesn't come from your journals. Comes from the life insurance industry, which I've written a lot about. I've sat on calls with executives from all the life insurance companies, all behind cameras, by the way. None of them wanted to show their face. But they saw a massive emergency in 2021. They reported, especially among young people, a 40% rise in year-to-year mortality in 2021. In the youngest and healthiest of society, this was group life health insurance, which is generally Fortune 500, white collar. They were dying at rates that outpaced any other sector, from 25 to 44. And you know when that it spiked? The third quarter of 2021. We saw young people dying in droves. You cannot dismiss that data. I don't care how many studies you show me. And I've compiled many studies you probably haven't heard of because they don't hit the big journals, but of huge increases in cardiac arrest calls to young people who just got vaccinated. I got a FOIA request from New York State. In February of 2021, you know what they were doing? Is vaccine clinics were calling the EMS to tell them they were vaccinating that day and they wanted them on standby. So 6 weeks, I have it written, it's FOIA request from New York State, and have you ever heard of a medical clinic calling an ambulance before they start work and saying, we want you on standby? And there's 4 instances of that throughout Westchester County. So just tell me why everybody started dying in 2021. Young people who've never died at those rates before. A 10% year-to-year rise is a 1 in 200-year event. Outside of wartime or a massive terrorist attack, it's never been described in the history of the life insurance industry. Theirs rose 40%. Something truly unique happened in the third quarter of 2021, and no one knows.
We do.
Okay, so if you want to show that the COVID vaccine saved lives, what you do is you look at the record level data. We have one record level data set that's publicly available that epidemiologists can look at to prove that the COVID vaccine saved massive numbers of lives. Do you know how many papers that have been published by epidemiologists who look at the only record level data set where you could prove that the COVID vaccine saved lives? You know how many papers were published? 0. So, look, if the COVID vaccine saved lives, and we have the record level data set that would show whether or not that was true, don't you think that every epidemiologist on the planet would be rushing to that data to show, see, we were right? Why are they all avoiding this publicly available record level data set that would tell us the truth? Now, Japan, they are the highest vaccinated population on the planet. These guys have like 6 or 7 vaccines because in Japan, you're very likely to follow the instructions of your health officials, so they're very obedient. They get all these shots. This led to 600,000 excess deaths in Japan over a 3-year period, the highest in their history. It's unprecedented. Do you know when the excess deaths started? It started when they rolled out the vaccines. Excess deaths were a flat line in Japan. They rolled out the vaccines, and the excess deaths skyrocketed. Anybody can go to Our World in Data, look at excess mortality, look up Japan, and see that. Now, it's supposed to be the other way around. When they roll out the vaccines, the deaths are supposed to go down, but what happened in Japan is the deaths went up like a straight line. There's the famous ARBEL study that was done in Israel in the HMO system. They looked at boosted versus non-boosted. They said, look, if you're boosted, you get a 90% drop in death rate. And some people in the US at Stanford and UCSF looked at that and they said, wait a minute. Non-COVID, these people who are unvaccinated died at 10 times more than the people who are vaccinated during non-COVID. In other words, the people who opted for the vaccine were less likely to die. So what they found was that this 90% protection offered by the vaccine was a complete mirage. It has to do with the healthy vaccinee effect, and it's because the people who refused the vaccine died at 10 times the rate of people who accepted the vaccine during non-COVID, which is essentially the control group. So naturally, you get COVID, they're going to die at a 10 times higher rate as well. This doesn't mean the vaccine worked, it just means the people who opted for the vaccines were healthier. There's no knee anywhere in the world that I could find when the COVID vaccines rolled out. What's supposed to happen is you look at all-cause deaths, you look at COVID deaths, and when they roll out the vaccine, whatever the trajectory it is, it's supposed to have a knee in it where it then flatlines as soon as they rolled out the vaccine. Guess what? That knee didn't happen anywhere in the world. Isn't that weird? And in Israel, when they rolled out the vaccine, you know, they talk about the vaccines are going to reduce infection. In Israel, which is another one of the highest vaccinated countries on the planet, they rolled out the vaccines, and I have the wastewater data, which basically tells you exactly what's going on, and it's the official wastewater data from the Israeli government, and what happened is that infections went up by 10x. Israel had the highest number of Delta cases in the entire world, and this was even admitted in the ARBEL paper. Now, if the vaccines prevent infections like we were told, why is the most highly vaccinated country in the world having the highest increase in COVID infections in the world? We don't know. You know, that's weird, isn't it? It's kind of called a natural experiment. And then there was the Levy study done in Florida. And then what they did is they matched like 9 million people with a very, very strict matching conditions. So only 10% of them exactly matched. They matched people basically, if you got vaccinated at the same place at the same time and lived in the same block, they would match you up. So they threw away 90% of the data and matched people very precisely on 7 different criteria. And Barbara Dickerman did a study, she's at Harvard, showing that if you match people on these criteria with very loose matching, you're also matching their comorbidities. Now, here, it was much, much tighter than Dickerman did, which means they're matched on all sorts of things, including comorbidities. Guess what? There was a 36% increase in the non-COVID all-cause mortality for people who got the Pfizer vaccine. Wait a minute. If these vaccines are perfectly safe, they shouldn't increase your non-COVID all-cause mortality at all. It should be a flat line. These things are supposed to be safe. So how can you have a vaccine which increases your all-cause mortality by 36%? That is a disaster, and nobody's been able to dispute that study.
All right.
There's been no study of VE of death that actually measured the non-COVID all-cause mortality of the unvaccinated. And finally, there's a great paper in JAMA. It's called the Z study XIE. It was published in 2022. and it showed that it was of veterans, and so it's the VA database. And it showed that the veterans who got the COVID vaccine, if they were hospitalized for COVID, 54% of them had the booster. But guess what? It's like 40% of them got the booster, or of the VA people were vaccinated. So in other words, it made you more likely to be hospitalized. And the hospitalization rate for COVID was 54%, and the hospitalization for non-COVID was also 54%, which means it provided no protection at all, because if it really worked, the boosted percentage would be like 0.
All right. Thanks, Steve. Dave and Dan, you guys have the floor. Also, we really need to cook here. We might have only time for one more topic, which I hope we can agree to do the ivermectin topic. But depending on how everyone's feeling on stage, we can also push the time. But go ahead, Dave and Dan.
Sure. So, Steve, you are saying that there is no record-level data studies. Can you define record-level data so we're all on the same page?
Sure. So record level data means you have a record for each person. You have a record of when that person was vaccinated. You have a record of what their date of birth was. Mm-hmm. And you have a record of each of their vaccinations and also when they died. And you can also, in that record, you can also have their COVID infections and so forth. But each person has a unique record. And what I'm saying is there's no publicly available data set that has the entire country, that has this information, that is available, because if there was, I'd be all over it, except for the check data.
So there are record-level data studies in countries where there are centralized healthcare systems, and it's very easy to pull those records and do analyses. Okay? So
name one.
Name one.
So Ip et al. Published in Nature Communications 2024, study of 46 million adults in England and Wales, COVID vaccine safety outcomes.
Great. Where's the data publicly available?
Where's the what?
Where's that data publicly available?
Nature Communications.
In Nature Communications?
No, that's their interpretation of the data. We're talking about the database.
The data. You want access? You want access to the records.
I want the records.
So you want to analyze the data.
Correct.
Why should we trust you to analyze the data instead of epidemiologists?
Because I want everybody. Science. I want everybody to have the data. That's the difference.
Steve, any research group can request data to do that study and do the study.
Do you know how many of us have been requesting data sets from numerous manipulated trials, numerous governments? All denied. I have colleagues all around the world in their own countries asking for access to the
again,
data.
We're going with shadowy, shady players suppressing data.
I said, why don't they disclose it publicly?
Steve, all the data is there for you to look at. And 46 million people. Do you know if they found?
Where is it? Where can I download it? Where can everybody?
Nature Communications. You can see exactly what they did and try to critique it.
That's not the database.
No, that's not the data set.
Do you have a problem with the data set?
Yes. I want to see it.
Why do you disagree with their analysis?
I don't know, because
trust
I haven't seen
but
the data.
verified.
Trust but verified. Show me the data.
We can show you the data. Do you know how to analyze it? Have you looked at it? Do you know how to identify problems with it?
Yes.
And what is the problem with this data set?
I haven't seen it. I can't.
I sent you the paper.
You didn't send me the data.
So the analysis found among 46 million adults in England and Wales that there is no increased risk for cardiovascular events, including heart attacks.
Then why don't they disclose the data?
Steve, you can't take public healthcare records and disclose it to everybody.
Why can't you?
They
did it in the Czech Republic. Did anyone die in the Czech Republic when they disclosed the data to everybody?
Steve, you've tried this with data sets that you've gotten your hands on, and your analyses are terrible. You don't understand what you're doing.
Really, Dan.
Yeah.
They're terrible. What's the correct analysis for the Czech Republic data, Dan? Where is your study of the Czech data?
So what's the first step in doing a good analysis of, say, the Czech Republic data? What's the first step?
What's the first step?
Yeah.
You can put it into all sorts of different models.
Models?
Like what?
Methods of analysis.
Be specific. You did this. What did you do?
I analyzed it all sorts of different ways. So at first I looked at time series data.
So what was the first
time series? That was
so you
like
just looked at a time series?
No, that was the first thing, right? There are all sorts of different ways to analyze the data. It's all the methods that I used are published on my GitHub. It's all in public view.
Yeah.
Everything I did is in public view.
Yeah, and you know what you didn't do? You know what you didn't do?
What didn't I do?
You didn't do the first step, which is to make sure that your two groups that you're comparing are comparable.
Oh, really? How are they not comparable?
So in the Scheck data, you argued that the vaccines were distributed randomly, right?
There is no evidence of a systemic.
That's what you did,
bias.
right?
There's no evidence.
So
of a
people
bias.
can choose their vaccine. There's a preferential recommendation against Moderna because we're not all in the pockets of big pharma, and we
Right.
go with the data.
Yeah.
So, and there's availability differences across the country, right?
Of
So
course.
it's not random.
No, it's not random.
But you argued it was random at one point. You had to be told it wasn't.
No, I said there was no systemic or systematic bias in the distribution of the vaccines. People didn't know which vaccine was going to be safer. Like, if you
They were
ask
advised. There was a preferential recommendation against
No.
Moderna.
No, there
Yeah,
wasn't.
yes, there was.
No, that's news to me. Where is it?
Steve, really? It's
Yes,
2025.
really. Where is that recommendation from that shows that there's a bias in the distribution? But it doesn't matter because you can look at
it does matter. It does.
Oh, okay. Why?
Because the first step of looking at this data set is making sure your first two groups are comparable. You want to be able to compare them accurately, so that it's not just statistical biases you're analyzing.
Steve wants the data.
So do you understand how the K-core method works?
K-core method?
Yes.
Is this what you did?
This is one of no. I looked at DSCMRR. I looked at GLM. I looked at.
But you didn't make sure your two. You didn't make sure the groups were comparable.
Kaplan-Meier.
You didn't make sure your groups were comparable.
Oh,
You didn't
the
adjust.
Method,
They were
the
randomized.
method that I use.
Sorry?
Is, the method
Randomized, Moderna and
It's not random.
Yes, it is.
It's not random.
No, but it doesn't matter, Dan, because
Can
I
people
didn't
choose
break
which
it-
to get, and is there a preferential
I didn't
recommendation?
break it
Yes,
down.
it's not random.
I didn't break it down by the vaccine manufacturer. I'm just looking at people who are vaccinated and unvaccinated. And of course,
Did you make sure those two groups were comparable?
As an expert in this.
Did you make sure those two groups were comparable?
Do you understand?
Yes
that
or no,
that's
Steve? Did you?
Dan,
Did
do
you? Yes or
understand-
no? It's the first step.
Do you understand that the groups are
Do you
never
understand
vol-
that that's
do you-
the first step?
Do you understand that when you have a vaccination, that the two groups are completely different? Do you understand that, Dan? So why are you asking me this question as to whether the groups are comparable?
Because you have to make sure they are
not.
as comparable as possible. Do you know why?
No.
Yes.
That's the whole point.
You have to make sure the two groups are
But
as
they're
comparable.
not.
Well, Steve, why do we do randomized controlled trials? Why is that the gold standard for clinical trials?
Because that makes it really easy for people to see a signal.
Why?
That makes it,
Why?
That makes it easy. Because they're randomized. Because
Exactly,
Yes.
because your two groups are comparable,
Right.
because they're
So-
random.
So Dan, when you don't have that available to you, you have
Don't
to
have a-
use
don't-
other techniques that normalize for the mortality of the two groups.
Exactly,
So that
and so
can
you
make
have
them
to
comparable.
you have to make sure that exactly
So-
you have to
so-
control for confounders. So
Right,
how did
so,
you,
so the
did you
first
do that?
Step in the first
yes.
step in the the first step in the algorithm is to make them comparable, so
How?
that you can then compare them.
How?
You fit the slopes to the death curves
That's
of
Steve.
fixed cohorts.
That's
So,
not that's
Dan-
not controlling for the confounders that would make the groups comparable.
But it does.
No, it
It
doesn't.
does, Dan, because do you understand? You understand?
It's
Gompertz
you
mortality?
versus the epidemiologists of the world on this, Steve.
No.
It's epidemiology 101.
Do you understand? Do you understand Gompertz mortality?
Sorry?
Do you understand Gompertz mortality?
Yeah.
You understand Gompertz mortality when we have when people are dying, right? Gompertz mortality just says, oh, it's an exponential. Great. But there's Gompertz mortality with depletion. Do you understand that?
And you understand that if you look at those curves, the people who are dying might be different in each group.
Do you know what their difference is?
Hold on, this is boring.
Do you, Steve? Because you had to control
yes,
for
I
them.
do.
What's the
Yes,
difference?
I do.
And
They're
you didn't
on-
control for them.
Believe it or not, they're on different parts of the Gompertz curve. Do you know what happens when you have a frailty of 3 or 5 as to where you are in the Gompertz curve? What does that do to your death slope when you're on the Gompertz curve?
So again, we're just going to say this is all you did, and you didn't account for epidemiology 101.
No, this is
All right.
this is not all I did. The first thing is to normalize the cohorts so that we take away the differences in the cohorts. And so what
So
I did...
are you controlling for age, socioeconomic
Dan,
status, smoking
All right.
status?
Tell me
Are
the
you controlling
negative
for pre-existing
control.
conditions? Are you
No, I don't
controlling
need
for
to.
health-seeking
No,
behavior?
All
I
right,
don't
guys,
need to.
I think
Don't need
you
to.
guys...
I have a negative
Did
control.
you just say you don't
I
need
have
to?
a negative
Did
control.
you, did you just say you don't
One-
need to?
Yes, because
You guys,
I have a negative control that shows
let's-
that it takes all of that
There-
out.
Let's
There you
hang
go.
on let's hang on for a second. Now, I'm going to ask you guys. We only have 6 minutes until we're at 90 minutes, and that's kind of what everyone agreed to. Do any of you object to staying on stage for a little longer to at least touch one more topic?
I'm good for however
Pierre,
long.
how do you
One
feel?
more question?
Well, I would love to do the Ivermectin question next.
I'll give 10 minutes.
10 minutes more?
That's
Okay,
it.
Pierre's
And then
okay
I'm
with
done
10
with
minutes
these guys.
more, and then we'll cut it. So let's start with Pierre on is ivermectin effective against COVID-19?
Yeah, so let me tell you the ivermectin story, and it fits in with a lot of what I've been trying to educate the folks in the group today, which is that when COVID broke out, all we did, I was a frontline ICU specialist, all we did is me and 4 colleagues got together and we devoted ourselves nights, weekends, everything in a frenetic pace, which we were on for about 2 years. Those first few months were, for an ICU doctor, I've never worked harder in my life. We reviewed everything. We talked to doctors in China and Italy. We came up with protocols for the hospital. We did not have an early treatment protocol, but we were focused because we were all ICU doctors. By the way, the people in that group were some of the most highly published physicians in the history of my specialty. Paul Marik literally is the most published practicing physician in the history of critical care medicine. Umberto Maduri is the world expert at the corticosteroids and treatment of lung diseases. And Joe Verone is on like 3 editorial journals. We all got together and we came out with protocol. We continued to follow the data. We were following everything, a totality of the evidence. We're not just waiting for the high-impact journals with their randomized controlled trials. You know, the only thing controlled about an RCT is the outcome. We looked at everything. We talked to everyone. And on the ground, we were treating. We started to see a signal around ivermectin. We had a dashboard, what we thought was probably good, not good, and neutral. We had a question mark under ivermectin. We'd heard things, but we had no data. Starting in early October 2020, studies started to come out from all around the world. Small studies, other studies, all consistent, same signal, large magnitude, times to recovery and mortality benefits. They were emptying hospitals. The most impressive one was published in Chest, which is one of the 2 top journals in my specialty. It was about a hospital in Florida that did a retrospective observational control trial, 70% decrease in mortality in the most severely ill in the hospital. That made it into Chest. And from then on, we put it on our protocol. I did a review paper, which I spent 2 months, 200 references, and I couldn't finish the paper because every day new studies were coming out, all lining up, same direction, same signal, same large magnitude. I put it up on a preprint server, and within 1 week, I treated my first patient with ivermectin. She'd been sick for 2 weeks, fever, fatigue, heart rate resting 120 in bed. She took ivermectin on a Sunday night. Within an hour, she felt flushed. She went to bed in the morning. Her heart rate was 80, and she was afebrile, and she felt energy, and she thought her life was saved. Okay, now, it could be, remember that's anecdotal, so we should dismiss that. It could be that night, at that particular time, was when her disease was going to take its natural curve. Correct. Happened to me 5 more times that week. What was showing up in all the data we were accumulating was showing up in my clinical observations. I testified before Ron Johnson, and that's when my entire career came to an end. As soon as I became an advocate for ivermectin, which is a low-cost, off-label, widely available drug that's highly effective at a disease that they were trying to monetize with remdesivir, molnupiravir, and Paxlovid, suddenly all eyes were on me. And this joker wants to make fun of the fact that I lost my boards. He has no idea why. It's only because I was a truth teller
think we know, buddy.
trying to recommend for a medicine to help save everyone. And then you know what happened next, guys?
You got
this
COVID?
is where I became an expert at what's called the disinformation playbook. And I didn't understand what was happening. I didn't expect a ticker tape parade, but I did think people were going to be appreciative that we were giving them guidance on how to treat it early and avoid hospitals. Instead, within 2 days of that, a huge hit job got published in the Associated Press on me and my group. And by the way, the tactics that I was to watch over the next 2 years, I wrote a book called The War on Ivermectin. One of my colleagues could have written the book The War on Hydroxychloroquine because it was the same war, same tactics. If you go to the article called The Disinformation Playbook, it outlines the 5 tactics. These guys have no idea of the 5. Number 1 is the fake. You publish trials with predetermined results, just like the Institute of Medicine. They are on record as sitting down at opening of their reviews in committee where the chair of the committee says, we are going to do what the CDC says, and we are going to find no association to autism. Read the transcripts, 2001. You don't believe me? Keep going, and you're like little trustful. Oh, everything's good. Science is working great. Pharma, oh, we know how to control pharma. You guys sound like clowns.
Trust fall into me, guys.
With
Trust fall into me.
Ivermectin, what I'll tell you,
Trust
with
this guy
Ivermectin
instead, right?
is what happened next is I read that article in 2021 in March, and it changed my life. Because as I was reading the 5 tactics, I had 3 or 4 examples for every tactic I was reading, and suddenly the world made sense to me again. It didn't make sense from December until March, and then I could see that this was a war, and they were using every single tactic. They went after the lead researcher of the WHO, who I was working with. He and I became collegial because we were so excited we found ivermectin. Guess what? They got to him. He self-retracted his paper and disappeared into obscurity. I've never talked to him since. That's what they did to ivermectin. They killed it using every tactic in that book. And the number 1 tactic, and if these guys want to do that, they can come to me with their trials. But in my book, it's a chapter called The Big 6. It should be called The Big 7. Right? The Big 7 were the large, rigorous, prospective, double-blind, randomized controlled trials, which definitively proved that ivermectin was ineffective. And all I've done for the last 3 years is show all of the manipulations in every one of those trials. If those guys want to hold them up as facts and truth and science, I can't help them.
All right, thanks, Pierre. That was, we got almost 6 minutes from Pierre there, so I want to award that to Dave and Dan here.
Look, it's a very simple thing to see what's going on here. He's right, it is a war, and it's a war against disinformation, and it's being perpetrated by this side. It's a very easy narrative to spin. Pharma wanted to crush the miracle cure. There's zero evidence that ivermectin treats COVID, and in fact, after his Senate hearing, if you take ivermectin, you won't get COVID. Fucking gets COVID, and then what does this pipeline lead to? All of these shady doctors setting up all of these, America's frontline doctors, Simone Gold, all these people prescribing ivermectin for people it's not going to help them an ounce, right? And the narrative doesn't play because in the meantime, dexamethasone, there are other drugs that were repurposed and approved for treating COVID. So the entire narrative falls apart. There are cheap generic drugs that were repurposed and used to treat COVID. So his entire angle falls apart. There's no big pharma conspiracy. It's just a bunch of lying assholes trying to make money. Ask him how much he charges for telehealth sessions. Ask him how much he charges for a consultation. Him, Simone Gold, all of these people, it's just a bunch of quacks selling snake oil. That's all there is to it. Who pays me? Why do I need to be paid? Why do I need to be paid? What am I charging to watch my YouTube videos? Do you have to pay money to get free information? Yeah, it's really cute that you guys are going to lie, but you have fucking nothing to say to what I said. Dexamethasone, all of these other... Yeah, everybody has to make money somehow. I have a YouTube channel. It doesn't mean I'm charging exorbitant fees to sell snake oil that get people killed. Because people took ivermectin, did not improve, and by the time they got to the hospital, it was too late. Pierre Kory, you are responsible for thousands of deaths. You go on Joe Rogan and you tell the fucking world that ivermectin treats COVID.
Hey.
It doesn't, and this is what happens.
From the audience.
The liar is there. I'm sorry.
Okay, that was 2 minutes. That was 2 minutes for Dave. Let's give 2 minutes to Dan. Go ahead.
I'll just add to that. So these people
hang on,
consistently...
1 sec. You guys calm down. It's important that we let our speakers get their information out, even if you disagree with them, okay? That's what good faith, helpful discourse is all about. Go ahead, Dan.
So Steve and Pierre constantly are telling you that it's all suppressed data. Everybody is lying and wants to suppress the data but them. And when I will tell you that when I look at science history and I see true mavericks in the scientific field, what they do is they are rigorous with their work and they convince their colleagues first. They get data that their colleagues, their competitive nerds, cannot argue with, and then they go off to say, hey, I have a real result. But what Pierre did and what he mentioned in his congressional testimony in front of Ron Johnson was, I think, really irresponsible because he did not do that. You did not get the randomized controlled trials convincingly showing that ivermectin was what you said, a miracle cure for COVID. That was incredibly irresponsible to do without that data. At that time, you could have been right. You could have been right. We didn't have the studies yet. It was way too early. But yet you were there telling non-experts, politicians, that it's a miracle cure, while your colleagues were not convinced yet. That is extremely irresponsible.
Never called it a miracle cure.
It's verbatim a quote from you. And you also said if you take ivermectin, you can't get COVID. Did you say that in a Senate hearing?
So I did, and first of all, I never said it was a miracle cure. I said these results are miraculous, and I don't want to be sensationalized for that.
You said it obliterates COVID and that it's miraculous.
And
With
it does.
zero data, with zero evidence, no randomized double-blind control trials, nothing.
There were randomized controlled trials at the time, and double-blind. Yes, there were.
No.
There were no convincing randomized controls.
There were zero.
Okay, so
every study done since then demonstrates no efficacy.
Everything that you read is true. They would never put something before you that's false. They would never want you to think that a cheap, safe drug is
What's up with the other cheap, safe generics that the cheap generics that they did approve?
Yeah, which ones are those?
Dexamethasone and what's the other?
Tocilizumab.
That's two.
Really?
Oh my God, we're undercutting
you
pharma
can
profits.
get
Cheap generics
tocilizumab?
repurposed.
It was approved and repurposed for COVID use.
Yeah, you know how expensive that is? It's only in the hospital. It's not an early treatment.
It is
corticosteroids.
It's a treatment for COVID.
It's not an early treatment, sir.
I didn't say it was an early treatment. It's a treatment.
It's incredibly expensive, even if it is off-spad, and you can only get it under very tight restrictions. They're not worried about tocilizumab. They're worried about the cheap stuff.
Is dexamethasone cheap?
You guys don't get the whole
dexamethasone.
It's only in the hospital.
Dexamethasone.
They're not worried about that. They're much more worried about outpatients. Oh. They want that market, sir. I'll teach you about pharma.
No, pharma stood to gain a lot from approving ivermectin.
All you have
use
to teach is
because
grifting.
Merck was the biggest producer of ivermectin. If we were in the middle of 2020 and the world was shutting down because of COVID, and ivermectin was the cure for COVID.
Okay, you can't yell idiot from the crowd. It's not helping anything. That's not good faith or helpful, so please don't do that. Go ahead,
If
Dan.
ivermectin was the miracle cure for COVID, and Merck was the #1 producer of it, and had a monopoly on the production of ivermectin, and could price gouge and do all the tricks that pharma does to make medications more expensive
the approval
than
of
what
other
they
cheap
are,
disarms also disarms the entire narrative.
They could have made a ton of money and saved the world from COVID.
Merck is not the biggest producer. They produce 1% in this country. The rest is produced by Edenbridge Pharmaceuticals, a little repurposed drug outfit. There are manufacturers all over the world.
Did they stand to gain a lot of money?
Ivermectin
Did they stand to gain a lot of money? Simone Gold made a lot of money selling ivermectin.
Simone Gold made fucking millions
a lot of manufacturers
hawking
around the world
ivermectin.
made a
Isn't
lot of
that
money
interesting?
And helped a lot of people. Saved lives all over India. That's how they get
fucking zero.
So I mean, again, they're going with this global conspiracy of suppression. But if you look on PubMed and go back to 2021 and look at all the randomized controlled clinical trials for ivermectin use in COVID, we have clinical trials from Egypt, from Sri Lanka, from the USA, from Australia, from the UK, from Thailand, and all over that all say that ivermectin did not help with their patients. These are doctors who, just like you at one point, Pierre, I don't know what happened, but at one point cared about patients.
Who do you think makes more money, those doctors or this guy?
So do you know how many randomized controlled trials there are for ivermectin?
Dozens.
20.
There's actually over
There are
50.
20, there are 20
over
back
50,
to 2021,
over
and many
50.
were retracted because
and
they were
when you put them in a
fraudulent.
meta-analysis, there's always a huge and very large signal of benefit on every single outcome. Recovery time, mortality, hospitalization.
Why
Over and
not?
over
Why
and
not
over.
on these clinical trials that you can see for yourself and read for yourself on PubMed?
Individual trials have many reasons to reach a negative result. That's why you don't rely on an
They
individual trial.
all point
No,
to
they
the
don't.
same conclusion, which is that it had no effect, no matter when they tried it. They tried it
Yeah, like
early in the COVID
Big
course.
Pharma got to all of
Like
them.
the study that you included, which was 1 dose of ivermectin.
Oh, I included
Yeah,
I
like that
included
one.
a random
That one's
list
a
from the
good
20
one.
studies I compiled.
One dose of ivermectin.
So
Great doctrine.
they tried high dose, they tried multiple doses, they tried high dose early, they tried high dose while the patient was in the hospital.
Yeah.
Nothing worked.
But you got to take ivermectin every week, right? Because they got to make money somehow, right? You know.
Yeah.
So,
I made money.
So if you go to c19early.org, have you guys been there?
Yeah, the meta-analysis website that puts a bunch of garbage in and garbage out.
The meta-analysis website that includes all of these treatments. You know what treatment is listed as number 1 most effective?
So is that
treatment of all of the treatments?
what is the meta-analysis including? Because you know that a meta-analysis is only as good as the data you put into it.
Yeah. So they try to track every study that was done.
So if you look right now on PubMed, the 20 studies that are randomized controlled trials for ivermectin, all but 2 of them will say no benefit. 1 is inconclusive.
You know how meta-analyses can be manipulated. I've been writing on this for
Exactly,
years. You guys aren't
meta-analyses can be
interested in
manipulated.
educating yourselves on how that sausage is made, then just keep holding it up as truth, and you're being lied to.
If you can point
you're
out,
being lied to in a sophisticated
Yeah, you're
way.
lying to
Actually,
us right
not
now.
that sophisticated.
If you can
you
point
just guys
out-
can't pick up on it. I'm
if
sorry.
you can point
Read my
out
book.
what is wrong
Yeah.
with these studies from all over the world, from independent experts studying this question, full of doctors who care about their patients and want to identify the cure for the thing that is shutting down the world in 2020. They want to identify that. That gets them big titles in science, right? They want that. You think that they're going to sit on those results
Yeah,
and bury them?
You know, I wanted to
No.
do, and my career ended.
Big Pharma.
That guy
Your
from
career
the WHO,
ended 'cause
you tell
you're
me
a
why the guy
lying
from
fraud.
The WHO self-retracted his paper and disappeared into obscurity. His career was done. You guys have no idea what you're talking about. Nice meeting you.
All right, guys.
Narratives,
thank you.
Run
Put,
away,
it- put
Pierre.
your hands
Narratives,
together for Pierre
data.
and Steve. We're out of time.
away,
We
Pierre.
are out of time. And for Dave and Dan as well. We are completely out of time. Thank you all for joining us. We're going to be back with more debates. We've been in Bronxlandia here with 2. I think we just witnessed the greatest vaccine debate in history. I don't know how you guys feel, but I think it was absolutely phenomenal. We don't have time for questions. I'm sorry. We gotta release our speakers. Dave and Dan are going to be signing posters
Look,
at the end here. If you want to get a poster signed from Dave and Dan, stick around and and they'll be available.
We're here. I'm happy to chat, but just not like 10-minute super debate. Like, I'm happy to have a brief conversation with you.
I
If
wanna-
you got, yeah.
I'd like to thank everybody for coming out.
Thank you so much,
Appreciate it.
Steve. Yeah, thank you.
You and I are predetermined nonsense, and that's okay. You and I have predetermined consequence, and that's okay. And that's okay.